All right, welcome back to Deep Dive. Today we're going to be tackling something that I think everybody listening is pretty familiar with: fever. The chills, the sweats, the thermometer reading that just keeps creeping up. But what's really going on inside your body when you've got a fever? And maybe, even more importantly, when do you really need to worry and when can you just ride it out?
Yeah, I mean, it's a question that comes up all the time, right? Should you let it run its course or just grab some meds right away? There's all kinds of advice floating around out there.
Exactly. So for this deep dive, we're going to look at some really cool research about fever. Stuff that gets into the science of when to treat it, how those fever-reducing meds actually work, the whole nine yards.
And by the end, you'll have a way better grasp on what's actually happening when your temperature spikes.
Okay, so let's get into it. One of the first things our sources really emphasize is that a fever isn't the illness itself. They actually describe it as, and this is kind of a mouthful, an ordinary response to a perturbation of normal host physiology. Basically, your body reacting in a normal way when something's off.
Right, right. That's a super important point to start with. I mean, it's easy to think of a fever like it is the sickness, but actually it's a sign that your body's defenses have been activated. It's doing something. And, most of the time fevers are linked to infections that your body's probably going to be able to handle on its own, like those common colds and viruses we all get.
And that brings us to the million-dollar question, right? Should you always try to bring a fever down right away? Especially with those common infections. I think a lot of people, myself included, honestly just reach for the medicine cabinet almost automatically.
Oh, absolutely, and I totally get it. I mean, fevers can make you feel awful. But the thing is, the research suggests that for those everyday, run-of-the-mill infections, taking those fever-reducing meds, those antipyretics, they don't actually seem to make you get better any faster.
Huh. So maybe that whole thing about sweating out a fever isn't as backed up by science as we might have thought, at least for those typical bugs.
Right. And you know what else is interesting? The research also suggests that having a fever doesn't necessarily mean you'll recover faster or that it'll supercharge your immune system to fight those common viral or bacterial infections.
Okay, that is interesting. So it may not be helping as much as we thought in those cases, but here's where things get really interesting. Our sources talk about some situations where not treating a fever can actually give doctors important clues. Like, it can be a really valuable thing from a diagnostic standpoint.
Oh, absolutely. Think about it this way. Let's say you think you might have a bacterial infection and you start taking antibiotics, but you're also constantly taking something to lower your fever. How can you really know if the antibiotic is working?
Yeah, that makes sense.
If you're masking the fever, you might be masking whether the treatment is actually effective. The research points out that this can be especially important when doctors don't have a lab test pinpointing the exact bacteria causing the infection.
So you're basically saying that treating a fever blindly can actually hide some really important information.
Exactly. You could be missing a key piece of the puzzle. And it's not just about whether an antibiotic is working or not. The research also mentions that letting a fever run its course can sometimes help doctors figure out those less common, those kind of unusual febrile diseases.
So the pattern of the fever itself, like how it goes up and down, can be a clue.
Precisely. And speaking of clues, we've got to talk about something called temperature pulse dissociation, which is also known as relative bradycardia.
Okay, temperature pulse dissociation, relative bradycardia. Lots of big words. Break that down for me.
So basically, sometimes your heart rate doesn't speed up as much as you would think it should based on how high your temperature is.
So, like, you've got a high fever, but your pulse isn't racing the way it normally would.
Exactly. And that little disconnect can actually point towards some specific conditions like typhoid fever, brucellosis, leptospirosis,
Yeah.
even some fevers caused by certain medications, and believe it or not, sometimes even factitious fever.
Factitious fever, what's that?
It's when someone is basically faking a fever on purpose.
Oh, wow. Okay. So, a slow heart rate with a high fever, that could be a red flag for something more
That could
serious.
be, yeah. It's a really specific detail that doctors look for.
Wow, fascinating. Okay, now switching gears a bit, our sources also point out that sometimes you might not even get a fever when you'd expect to. Like, you might actually be sick, but not have a fever at all.
Yeah, that definitely adds another layer of complexity to things.
Right, because I think we tend to think of fever as kind of a universal sign of infection.
We do, but the truth is, some people are just less likely to develop a fever, even if they are fighting off an infection.
Like who?
Well, newborns, for example,
Mm.
and older people, and people with chronic liver or kidney failure. Also, anyone taking glucocorticoids, which are a type of steroid medication.
So basically, if you fall into one of those categories, you can't always rely on a fever to tell you if you're sick or not.
Right. The absence of a fever doesn't necessarily mean you're infection-free.
Okay, that's really important to remember, especially for those more vulnerable folks. And and it gets even trickier, right? Because the research also mentions hypothermia, which is when your body temperature drops dangerously low in the context of septic shock.
Yes, exactly. When you have a really severe, overwhelming infection that leads to septic shock, your body's systems can basically go haywire. And sometimes, instead of a fever, your body temperature might actually plummet. It can be a late sign that something very serious is going on.
So we're seeing that fever isn't just the simple yes or no indicator of illness. It's way more nuanced than that. All right, so we've talked about when to treat a fever and when not to. And we've even touched on how the absence of a fever can sometimes be important. But now I want to get into how your body's temperature response can actually act like a detective, giving us clues about what's going on. Our sources lay out some really interesting characteristic fever patterns that can point towards specific infections. It's like something out of a medical mystery novel.
It really is. So for example, let's say you notice a fever that spikes every third day, like clockwork. That's a pretty strong sign of infection with Plasmodium vivax, which is a type of malaria parasite. And if the fever comes every fourth day, then Plasmodium malaria might be the culprit.
Wow, so the timing of the fever itself can help narrow down what's causing it.
Yep. And it doesn't always have to be at regular intervals either. Think about relapsing fever, which is caused by the bacteria Borrelia. With this one, you get a few days of fever, then it goes away completely for a while, and then boom, it comes back.
Ugh, that sounds awful. Okay, what about Pell-Epstein fever? I'm not familiar with that one.
So the Pell-Epstein pattern is a cycle of 3 to 10 days of fever, followed by 3 to 10 days without a fever. And it's been linked to Hodgkin's lymphoma and some other types of lymphoma.
Interesting. So it's a much longer cycle than we've talked about so far.
Right. And it really highlights that fever patterns can clue us into things other than just infections. They can be a sign of other underlying conditions.
Okay. Are there any other examples of these characteristic fever patterns?
Well, there's cyclic neutropenia, which is a condition where your levels of neutrophils, a type of white blood cell, drop periodically. And it's often accompanied by fevers that pop up roughly every 21 days, right when those neutrophil levels are low.
Gotcha. So again, very specific timing. All these different patterns really drive home the point that fever isn't just some generic reaction. It can actually have its own unique signature depending on what's causing it. Okay, so we've covered typical fevers, atypical fevers. Now I want to talk about a situation where recurring fevers might point to something entirely different. Periodic fever syndromes.
Right. These are a group of genetic disorders that are characterized by, well, recurring episodes of fever along with other symptoms.
Like what?
The research mentions familial Mediterranean fever, or FMF, and TNF, receptor-associated periodic syndrome, also known as TRAPS.
Okay, so if you have fevers that keep coming back again and again, it's not always because you keep getting reinfected. It could be something genetic.
Exactly. And the thing about these periodic fever syndromes is that they all have their own quirks. I mean, they differ in how often the fevers happen, how long they last, the other symptoms that come along with them, what causes them genetically, and how you treat them.
So basically, figuring out the exact syndrome is key for getting the right treatment.
Yep. And that brings us to a related topic, how doctors use anti-cytokine therapy to treat fevers in people with autoimmune and autoinflammatory diseases. The research points out that recurring fevers are common with both.
Now, we hear a lot about autoimmune diseases where the body basically attacks itself, but autoinflammatory is a term I'm less familiar with. What's the difference?
So with autoimmune diseases, your immune system is misfiring and attacking your own tissues. With autoinflammatory diseases, it's more like your innate immune system, which is your body's first line of defense, is just going haywire. It's overreacting without a specific target.
Okay, so what kinds of conditions are we talking about here?
Well, the periodic fever syndromes we just discussed fall under this umbrella. And they're all characterized by these recurring fevers, often with an increase in neutrophils, those white blood cells, and inflammation in the serous membranes.
What are serous membranes?
They're the linings around things like your lungs and your gut. Some specific autoinflammatory diseases that are mentioned include adult and juvenile Still's disease, familial Mediterranean fever, that's FMF again, hyper-IgD syndrome, and then some more common things like idiopathic pericarditis and gout.
So lots of different possibilities there. And the interesting thing is, while those standard fever reducers can help manage the fevers in these conditions, there's a more targeted approach doctors can use, anti-cytokine therapy.
Exactly. See, the fevers in a lot of these autoinflammatory diseases are driven by these inflammatory proteins called cytokines, specifically interleukin-1 beta or IL-1. So medications that block IL-1 can be really effective at tamping down those recurring fevers.
Like hitting the problem right at the source. Okay, let's shift gears now and talk about how those standard fever reducers actually work. We're at the part of the research on the mechanisms of antipyretic agents. It all starts in the hypothalamus, right?
Right. Your hypothalamus is this little part of your brain that acts like your body's thermostat. Yeah. Like the dial you use to set the temperature in your house. It's what controls your normal body temperature. And when you get a fever, that set point gets turned up.
So antipyretics, those fever reducers, they work by basically telling the hypothalamus to turn the thermostat back down.
Exactly.
And the key player in turning up that thermostat in the first place is something called PGE2.
That's it. Prostaglandin E2, or PGE2, it's a molecule that acts in the thermoregulatory center of the hypothalamus to increase body temperature.
And how does PGE2 get produced? The research mentions something called arachidonic acid.
Yeah, so the process starts when arachidonic acid is released from the cell membrane. And that release is actually the rate-limiting step, meaning it's what determines how much PGE2 can ultimately be made. Once arachidonic acid is released, it's acted upon by this enzyme called cyclooxygenase, or COX, to make PGE2.
So if you block COX, you reduce PGE2 levels, and that brings the fever down. Makes sense. And the research actually says that how well those different fever-reducing drugs work is directly related to how well they inhibit COX in the brain.
Exactly. The more a drug can block COX activity in the brain, the stronger its fever-reducing effect tends to be. Now, acetaminophen, you might notice paracetamol, it works a little differently than those other common antipyretics.
Right. The research points out that acetaminophen isn't a very good COX inhibitor in the rest of the body. It doesn't have much of an anti-inflammatory effect. So how does it work on fever?
Well, what scientists think is happening is that when acetaminophen gets into the brain, it's metabolized, basically. It's processed or transformed by this system called the P450 cytochrome system, and that modified form of acetaminophen does inhibit COX activity.
Interesting. So it needs to be tweaked by the brain before it can really do its job.
It seems that way. And there's also this possibility that another enzyme called KOX3 might play a role in how acetaminophen reduces fever. But KOX3 isn't found outside the central nervous system. So unlike some other pain relievers that work more broadly, acetaminophen seems to zero in on that fever control center in the brain after being processed by the body.
Okay, so acetaminophen has more of a targeted effect in the brain compared to, say, aspirin or ibuprofen. And speaking of those two, the research says that good old oral aspirin and acetaminophen are actually equally effective when it comes to bringing down a fever.
That's right. And then you have the nonsteroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and the COX2 inhibitors. Those are also really good at lowering fevers.
Okay, so let's sum up everything we've learned in this deep dive about fever. First, and maybe most importantly, fever is a normal physiological response, not an illness in itself. And for a lot of common infections, treating the fever might not actually make a difference in how quickly you get better. In fact, sometimes not taking fever reducers can give doctors valuable information to help them figure out what's wrong.
Right.
We talked about certain clues, like when your heart rate stays low, even though you have a high fever, and how some people, especially those who are more vulnerable, might not get a fever even when they're sick. We also got into those fascinating fever patterns that can point towards specific infections, and then all the complexities of periodic fever syndromes and those targeted therapies for autoimmune and autoinflammatory diseases. And finally, we dug into the science behind how fever reducers work, how they target that thermostat in your brain by lowering PGE2 levels through COX inhibition, with acetaminophen having its own unique brain-focused mechanism.
Wow. Yeah, you covered a lot of ground there.
I know, right?
No.
But hopefully it was helpful. And it really underscores the fact that fever is a lot more complicated than just a number on a thermometer.
Totally agree.
So this brings me to a final thought I want to leave you with. If fever, which we often try to suppress, is actually a physiological response that might have some benefits, what other common bodily reactions might we be misunderstanding or treating too quickly? Could there be upsides to taking a more nuanced approach to some of our body's other natural defenses? I think it's a question worth pondering. Thanks for joining us on this deep dive, everybody.
See you next time.